Have you ever walked into a doctor's office and wondered what's going through their mind as they greet you? It's not something most of us like to think about, but the reality is that doctors, like all of us, form opinions about their patients, sometimes even before the appointment begins. For older adults, those opinions can carry hidden assumptions that quietly shape the care you receive. Behind the professional demeanor and polite smiles, some doctors hold unspoken beliefs about aging that can influence how they listen to your concerns, diagnose your symptoms, or recommend treatments. These beliefs aren't always shared openly, but they can have a real impact on the quality of care you get. In this video, we are going to uncover 5 eye-opening truths about what many doctors might actually think when treating older patients. These insights are not meant to scare you or make you distrust your healthcare providers. Instead, they're here to empower you with knowledge so you can advocate for yourself and ensure you're getting the respect and care you deserve. Stick with me until the end, because the final truth might just change how you approach your next doctor's visit. Let's dive in and explore these truths together, starting with the first one. Truth number 1. They often assume most symptoms are just old age. One of the most frustrating experiences for older adults is when a doctor dismisses their symptoms as just part of aging. You might walk into the office complaining about joint pain, fatigue, memory lapses, or shortness of breath, only to hear something like, "Well, that's normal for your age." While it's true that aging brings changes to the body, this assumption can be a shortcut that leads to misdiagnoses, delayed treatments, or missed opportunities to address treatable conditions. Doctors are human, and they work under intense pressure. With packed schedules and limited time per patient, it's tempting to lean on the simplest explanation for a symptom, especially when it's a common complaint among older adults. For example, joint pain might be brushed off as arthritis, fatigue as a natural slowing down, or forgetfulness as a senior moment. But these quick judgments can gloss over serious, treatable conditions like heart disease, thyroid issues, vitamin deficiencies, or even early-stage cancers. When a doctor attributes a symptom to aging, the urgency to investigate further often fades. A persistent cough might be dismissed as a normal part of getting older, when it could be a sign of chronic lung disease or heart failure. Memory issues might be labeled as inevitable, when they could stem from medication side effects, depression, or a reversible condition like a vitamin B12 deficiency. By assuming it's just age, doctors may miss opportunities to improve your health and quality of life. Let me share the story of Robert, an 82-year-old man who began experiencing extreme fatigue and occasional dizziness. His doctor initially told him it was just his body slowing down with age and suggested he rest more. But Robert felt there was more to it. After months of feeling dismissed, he insisted on further tests. It turned out he had a heart valve issue that was treatable with a straightforward procedure. Once it was addressed, his energy returned, and he was back to enjoying his daily walks. Robert later said he wished someone had taken his complaints seriously from the start. As a patient, it's critical to challenge the "it's just aging" narrative. Your symptoms deserve a thorough investigation, no matter your age. Here's how you can advocate for yourself. Be specific about your symptoms. Describe exactly what you are experiencing, when it started, and how it affects your daily life. For example, instead of saying, "I'm tired," say, "I have been too exhausted to walk to the mailbox for the past 2 weeks." Ask questions. If a doctor suggests your symptoms are age-related, politely ask, "What else could be causing this?" Or, "Can we run tests to rule out other conditions?" Push for testing. If you feel your concerns are not being addressed, request specific tests like blood work, imaging, or specialist referrals. Your health is worth the extra effort. Aging is not a catch-all explanation for every health issue. Your body may change over time, but that does not mean every ache, pain, or change is inevitable. By speaking up and demanding answers, you ensure your health gets the attention it deserves. Your quality of life at 80 is just as important as it was at 40. Truth number 2. They may believe older patients are less likely to follow treatment plans. Another unspoken truth is that some doctors assume older patients are less capable of following through with treatment plans. This belief often stems from stereotypes about memory, hearing, or the ability to manage complex medical instructions. While these challenges can affect some older adults, assuming they apply to everyone can lead to oversimplified care that doesn't serve your best interests. If a doctor thinks you will struggle to follow a treatment plan, they might. Simplify your care. They may prescribe fewer medications or avoid complex therapies, assuming you would not manage them well. Withhold options. Cutting-edge treatments or lifestyle changes might not be offered because they assume you are not up for the challenge. Limit explanations. They might skip detailed discussions about your condition, thinking it's too complicated for you to grasp. This approach can mean you miss out on treatments that could significantly improve your health. For example, a doctor might avoid recommending a new arthritis therapy because it involves multiple steps, even if you're willing and able to try it. Or they might not explain how diet and exercise could complement medication for managing diabetes, assuming you won't follow through. Consider Carol, a 79-year-old woman diagnosed with a heart condition. Her first cardiologist gave her a basic treatment plan, assuming she wouldn't want or could not handle anything more involved. But Carol was determined to stay active and engaged. When she switched to a new doctor, he took the time to explain all her options: medication adjustments, dietary changes, and an exercise plan tailored to her needs. With this comprehensive approach, Carol managed her condition better and felt more empowered in her care. To counter this assumption, show your doctor you're engaged and capable. Bring a notebook. Write down instructions, questions, or details during your appointment. This signals you're serious about your care. Ask for clarity. If a treatment plan seems vague, ask for specifics. For example, can you write down the steps for this medication? Or, what are all my treatment options? Demonstrate commitment. Share how you have followed through on past recommendations or how you manage other aspects of your life like hobbies or schedules. By proving you are ready to take an active role, you can break down stereotypes and encourage your doctor to offer the full range of treatments. Your age doesn't determine your ability to follow through. It's about your willingness and the support you have. If you are finding this video helpful so far, please drop a 2 in the comments to let me know you're here. And if you haven't already, hit that subscribe button and turn on the bell so you don't miss any of our videos. Your support helps us keep creating content to inform and inspire you. Now, let's move on to the next truth. Truth number 3, they may prioritize younger patients in certain situations. This one is tough to hear, but in some cases, doctors may unconsciously prioritize younger patients, especially when time, resources, or attention are limited. This is not always intentional. It can stem from a belief that younger patients have more years ahead, so their treatment carries a greater long-term impact. But for older adults, this bias can result in less urgency, fewer follow-ups, or being overlooked for procedures that could still offer significant benefits. In busy clinics or hospitals, doctors often juggle multiple patients with competing needs. When time is tight, they might instinctively focus more on a younger patient, thinking their intervention will yield a bigger payoff. For example, a doctor might order extensive tests for a 30-year-old with chest pain, but suggest a wait-and-see approach for a 75-year-old with similar symptoms. Or they might hesitate to recommend surgery for an older patient, assuming recovery will be harder, without asking if you're willing to take on the challenge. This mindset undervalues the importance of quality of life at any age. A 75-year-old deserves the same chance to live pain-free, stay active, or enjoy daily activities as a 40-year-old. Denying or delaying care based on age can rob you of years of independence, mobility, or joy. It can also mean missing out on preventive measures that could catch serious conditions early. Take Richard, an 82-year-old who suffered from severe knee pain. His first doctor dismissed the idea of knee replacement surgery, saying it was too risky for his age. but Richard was healthy, active, and eager to stay that way. He sought a second opinion, and the new surgeon evaluated him based on his overall health, not just his age. Richard had the surgery, recovered well, and was back to his daily walks within months. His story shows that age should never be the sole factor in medical decisions. To ensure you are not sidelined, communicate your goals. Tell your doctor what you want to achieve, whether it's staying active, traveling, or simply feeling better. Make it clear your quality of life matters. Request equal consideration. If you sense your concerns are being downplayed, ask, would you recommend the same approach for a younger patient with these symptoms? Seek second opinions. If you feel your needs are not being prioritized, do not hesitate to consult another doctor who will evaluate you based on your health and goals, not just your age. Your time, comfort, and future are just as valuable as anyone else's. By advocating for yourself, you can shift the focus from how long will you live to how well can you live. Truth number 4. They may see your life goals as less important. Some doctors, often without realizing it, assume that older patients have simpler priorities, mainly comfort and basic health maintenance, rather than ambitious goals like traveling, pursuing hobbies, or starting new ventures. This assumption can shape the treatments they offer, leading to care that feels limiting or uninspired. If a doctor believes your main goal is to get by, they might focus on quick fixes, like prescribing medication for pain, instead of exploring options that could restore your ability to hike, garden, or dance. They might not discuss therapies or lifestyle changes that require effort, assuming you're not interested in long-term improvements. This can leave you with a treatment plan that meets basic needs, but doesn't support the vibrant life you want to lead. Ellen, an 81-year-old woman, dreamed of visiting her granddaughter overseas despite a chronic lung condition. Her first doctor suggested she focus on staying comfortable at home, assuming travel was too much for her. But Ellen was determined. She switched to a new physician who listened to her goals and created a plan that included exercise, medication adjustments, and travel preparation. 6 months later, Ellen made the trip and described it as one of the happiest moments of her life. Make sure your doctor sees you as a whole person with dreams and ambitions. Share your goals. Tell your doctor what matters to you, whether it's gardening, traveling, or staying active in your community. For example, say, I want to be able to walk my dog again. How can we make that happen? Ask about all options. If a treatment feels too basic, ask, are there other approaches that could help me achieve more? Or, what can I do to get back to my favorite activities? Be proactive. Show your doctor you're willing to put in the effort for better outcomes, whether it's through physical therapy, dietary changes, or learning about your condition. Your goals matter, no matter your age. By sharing them with your doctor, you can ensure your care aligns with the life you want to live. If you're still with me and finding these insights valuable, drop a 4 in the comments to let me know you're here. And if you haven't subscribed yet, hit that subscribe button and turn on the bell to stay updated. Your support means the world to us. Now, let's get to the final truth, the one that might change how you approach your next appointment. Truth number 5. They may underestimate the emotional impact of aging on health. While doctors often focus on physical symptoms like blood pressure or joint pain, some overlook the emotional toll of aging and how it affects overall health. Aging is not just about the body, it's about navigating losses, changes in identity, and sometimes reduced independence. When these emotional factors are ignored, treatment plans can feel incomplete, leaving critical needs unaddressed. Emotional well-being is deeply tied to physical health. Loneliness, grief, or anxiety can disrupt sleep, weaken the immune system, or slow recovery from illness. Yet, some doctors don't ask about these issues because they are not part of a standard medical checklist. They might attribute sadness or withdrawal to getting older, instead of recognizing it as something that can be addressed through counseling, support groups, or lifestyle changes. Leonard, a man in his late 70s, lost his wife of 54 years and soon noticed his health declining. His doctors focused on tweaking his medications, but never asked how he was coping emotionally. It wasn't until a neighbor suggested counseling that Leonard began addressing his grief. With emotional support, his physical health improved significantly, not because his prescriptions changed, but because his emotional burden was finally acknowledged. To ensure your emotional health is part of your care. Speak up. Share how you're feeling, even if it seems unrelated to your physical symptoms. For example, say, "I've been feeling lonely since my spouse passed away," or "I'm worried about losing my independence." Ask for resources. If your doctor doesn't address emotional concerns, ask, "Can you recommend a counselor or support group?" Or, "Could my mood be affecting my health?" Be honest. If you are struggling, do not just say, "I'm fine." Give your doctor the full picture so they can tailor your care to your needs. A good doctor understands that treating you means caring for both your body and mind. A single conversation about your emotional health can be as powerful as any prescription. Hearing these truths might stir up a range of emotions: frustration, recognition, or even determination. But the goal here is not to make you distrust doctors or feel discouraged. It's to arm you with knowledge so you can walk into your next appointment with confidence, ready to advocate for the care you deserve. Your health, your goals, and your dignity matter just as much now as they did decades ago. The best medical outcomes happen when you and your doctor work as a team. Be honest about your concerns, ask questions, and don't hesitate to seek a second opinion if you feel unheard. Your life experience, resilience, and unique story make you more than just a patient. You're a person with a right to exceptional care. Thank you for watching today. I'd love to hear from you. Drop a comment below with one thing you learned from this video and how you plan to use it in your next doctor's visit. Your thoughts inspire us to keep creating content like this. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. Your support helps us continue to inform and empower you. Thanks for being here, and I will see you in the next video.